Are you pregnant or you're planning to be pregnant and you're living here in the United Kingdom? This video is for you. Even if you're not pregnant and maybe something you want to have an idea of, please keep watching. Hello everyone, welcome back to my channel. My name is Chinasa. It's really good to have you here today. And today we're going to be talking about pregnancy and childbirth here in the United Kingdom. Disclaimer, I am not a health advisor. I am not a midwife. Everything I'm going to be saying in this video is based on my own personal experience and the research. So this video, we're going to be talking about pre-pregnancy, pregnancy, post-pregnancy, and the most interesting part, the highlights of giving birth in the United Kingdom. Now, let's get right into the video. Before you ever talk about pregnancy, you should consider some things. The very first one is your physical status. How are you physically? Are you really fit to do this? The second is mentally, your emotional status. How are you mentally? Is everything okay? Are you really in the right frame of mind? Because believe me, pregnancy and childbirth is something that you really need to prepare for. And then thirdly is financial status. Delivery is free here in the United Kingdom, but childcare is not. You really have to put this into consideration. Who is going to help you take care of the child? Which nursery? Which income? You need to think about all these things. And then you also have to think about your maternity pay. It's really good to get pregnant when you are sure that you're going to be paid, okay? Because we have bills here and it's monthly and they're not going to stop because you put to bed. They're not going to stop. So you just have to plan it in a way that if you put to bed and you're at home, you are getting this pay to help offset your bills and to encourage your daily living. Let's talk about pregnancy now. You're now pregnant and the first thing you should do is to register at the hospital or your midwife or your GP. Now, the midwife is going to ask you a series of questions about your history, your past medical history, your family background, loads of questions. And also, they'll book you in for your first scan. When they book you in for your first scan, you're also going to be doing lots of blood tests. They're going to check for Down syndrome, the chances of your child having a Down syndrome. They're going to check for syphilis, your hepatitis level, and HIV. So many checks, believe me. And also, they're going to give you the option of choosing a location for your birth. Maybe in your area, there are 3 hospitals. They're going to tell you about them and then ask you to choose the one that you would like to deliver in, which is very nice. There's what we call MAT-B1 form. You need this form from your midwife at around 20 to 28 weeks of pregnancy. You need it to submit to your employer, because when you submit it to your employer, it's going to enable them to apply and approve your maternity pay. You need to submit this, remember, within 20 to 28 weeks, depending on your organization. Also, be aware that health visitors can visit you in pregnancy. They're going to visit you to ask about your welfare, how are you coping with the baby, and all that. That being said, the next thing you should also do is to apply for your maternity leave. You should do this usually 15 weeks before your EDD. EDD is expected date of delivery. It depends on your employer or your organization, but it's usually 15 weeks before your EDD. Your partner also should apply for his paternity leave. I think it's usually 2 weeks, and your partner will also need your MAT-B1 form. After that, you should pack your bags. Yeah, pack your bags and get ready to deliver your newborn baby in the hospital. Also, it is worthy to mention that when you put to bed, maybe you have a baby girl or a baby boy, NHS here does not do circumcision and they don't do ear piercing. I think there are registered private clinics or hospitals that do this, but just bear it in mind that unlike where I'm coming from, like my home country, the hospital does the circumcision and ear piercing. Here, NHS do not. You give birth and you take your child home. You can source all these other things privately, but make sure they are registered to avoid any issue. Make sure they are professionals that have been trained and have certificates of doing this. Now let's get to this part of the video. There are really things that stood out for me. I mean, there are things that I was so impressed with. The very first one is the care, the level of care, the level of support you get from your hospital, your midwife, from the midwife, the healthcare assistants, the doctors. Let me thank the NHS team. They're really doing a good job. Honestly, the way they talk to you, their tone, their voice, the soothing voice, and the way they talk to you will make you feel so calm and so relieved. The assurance they give you, you really feel safe. I think that's the very first thing that struck me. The love, the support is very worthy to know. So if you're pregnant, just know that this is something you're going to enjoy. Then the second thing is everything is free. Everything is free. Free scans, free prescriptions. You don't even need to, like, when back home they will give you list of things to buy, buy methylated spirit, cotton, but no, here you're not buying anything. Just pack your bag for your personal need, maybe your sleeping outfits, slippers, and then you pack some clothes for your baby. But every other thing is taken care of by the NHS and it is free. And some people will say, technically it's not free, you are paying tax. We're paying tax. We pay tax everywhere. And if you should tell me the tax we pay, honestly, from my experience, the tax we pay is nothing compared to this, to these things being free. I've not even talked about the free dental treatments for pregnant women. I just put to bed, so I'm still entitled to free dental treatment for up to a year, like till my baby turns a year. So from pregnancy to your baby turns a year, that is maybe approximately 2 years. So it's very nice. Now this should not make you to start giving birth because it's free. No, because even though it's free, we all know that childcare is not free. Another thing to mention is health visitors. When you give birth, I like the support both in the hospital and after when you come home. Unlike my home country, when you come home from the hospital, you are done with the hospital. Nobody is really coming to see you or anything. But here, the health visitors kept coming. Every day they come in, check on you, check on your baby, how is baby doing, weigh the baby, check for jaundice, check so many things about the baby, do some tests. The support is really amazing. You just have it in mind that, okay, if anything goes wrong, these people will come in tomorrow. Or if you have any questions, I'm going to ask them tomorrow when they come. Do you get it? Like, it is really nice. I really enjoyed that period. Another thing is the 24/7 contact to reach out to when you have questions or an emergency. Even during pregnancy, you have numbers to call, and when you call, I remember I called a few times and they picked. Even 12 a.m., 1 a.m., there is this number that you can always call and you get the right advice or support that you need. It's wonderful. We all know that pregnancy comes with this anxiety, this nervousness that you always think something is going wrong or something is wrong. So if you have this kind of support, any question you have, you can easily call and they talk to you and you get back to your normal self. That anxiety goes down immediately. So it is very good. It is something I really enjoyed. Also, the varied support, like they have a branch or like they have a branch or a contact for different problems or different issues you might have. If it's financial, they have. If it's emotional, if you've lost a child before and you need someone to talk to, if you are going through any challenge, they have it. And do I also need to mention that here, abuse is limited. I can't even count the number of times they asked me questions on abuse. Is your partner treating you well? Is everything okay at home? Are you in control of your money? It's none of my business because I have a really supportive and caring man, okay, as a partner. But for people that don't, this is an opportunity to raise it as a concern. So it is very nice knowing that you are safe. And even if you are not safe in your home, you have where to voice it out. You have people to speak to. Do you get it? So this is also something that stood out for me. Another thing that is worthy to mention is the maternity leave. Wow, 12 months of maternity leave. Honestly, I think that should be the highlight of everything. 12 months. And in that 12 months, 9 months is paid. I'm going to talk about maternity leave and pay and benefits in another video. I'm going to explain everything about that, but I'm just mentioning it here. You get 12 months of maternity leave, and if you qualify or eligible for the both, that's from the government and from your workplace, then just be rest assured that you're going to be paid for 9 months. It might not be full, that your full money that you've been earning when you were working, but it's something. Staying at home, taking care of a child, and at the end of every month, just like when you were working, you get an alert. It's something that is really nice and so supportive, because I am now home and I'm just taking care of my child and I'm getting paid every month. No matter how much, it's helping to set off my bills, support the family, and all of that. The last but not the least is the risk assessment from workplace. When I was pregnant, my manager did risk assessments for me. This is to know if your pregnancy is high risk, how your pregnancy is, are you able to continue with your work, are you able to position you in a place that won't really stress you and the baby, avoid infections and all of that, which is really nice. I mean, in fact, I enjoyed my pregnancy because my workplace was really supportive to me. Even some of my colleagues, they were really nice. So honestly, in general, let me just say that pregnancy and childbirth in the UK is really a nice experience, and I enjoyed every bit of it. I won't say I'm missing being pregnant because when I was pregnant, I know at the very tail end, I was already tired. I said, I don't want this again. Let me just say, I like where I am now. But when I was pregnant too, it was really lovely. Okay, so for you all that are planning to get pregnant here in the United Kingdom, or you're pregnant already, I really wish you the best. It's a wonderful experience and you won't even regret it. Good luck in your delivery. Good luck. Good luck. Thank you so much for watching my video. Everyone that I've watched to this point, thank you so much. And to all my subscribers, you all are really wonderful. The engagement on my last video, all the comments, the good wishes, I really appreciate it all. Thank you for sticking by. Thank you for loving me, and I love you too. Please watch, subscribe, like, and share my video. Okay, let's keep growing. Thank you very much for your support, and I will see you in my next video. Bye bye.